As a patient or an employee, what's the most insane thing you've seen or experienced in a hospital? I was a patient in A&E, and a young guy came in drunk as all fuckery, and he had ripped his sack open trying to jump a bollard. Well, when he saw the needle the nurse had to use to numb his franken beans, old mate was not having it. Cue what was almost like a horror version of a Scooby-Doo chase scene, with flappy sack guy running in and out of room sans pants, while getting chased by a bunch of security and nurses. They finally caught him, and he promptly passed out, so they continued his care while he was snoring away. I was just sat in my hospital bed, trying not to laugh too hard and pop my stitches, while messaging my mum like, "You are not gonna believe what I just watched." Posted this in another thread before. Weekend afternoon, one of the first nice days of spring. Slow day in the ER for the most part, when in comes a distressed younger couple with their infant baby. Mom is hysterical, and Dad is barely keeping it together. Dad gets it out that baby is bleeding from his mouth. I'm skeptical, because the baby looks quite happy, but I do see a slight reddish-pink tinge inside his mouth. I take the child and put him down on the exam table, all bright lights and tongue depressors to get a good look in the baby's mouth. Sure enough, evidence of blood, but again, no baby distress. Oh wait, there's something near the back of her mouth, kind of a darkish red color. A blood clot, maybe? Not sure. Have a coworker firmly immobilize the head, and with hemostats, go in and pluck out the object. Amazingly, it comes out in one piece, and looks like a plump, slightly larger sized raisin. I can't figure out what it is, but it's definitely not a clot. Into the specimen bag goes the squishy thing. No distress for the baby, vitals normal, breathing easily, happy demeanor, good color, etc. Time to get more of a history from Mom and Dad. First day outside with new baby and their dog, enjoying the weather. Baby's on a blanket, giggling as the dog runs around him. Wait a sec, did you say? A dog. Let me take a closer look at the thing in the specimen bag. Sure enough, suspicions confirmed. It's a tick. Deflated to be sure, but a tick that recently had a large meal of the red stuff. Baby must have pulled it off the dog and then done what babies do by putting it in his mouth. Infant pulled a full tick off of family dog and chewed it. While in the emergency room for an asthma attack as a child, 2 teenage boys were brought in by ambulance. They had been huffing silver paint. At first, I thought it was funny because they looked stupid with the paint on their faces. Then my mom started crying hard. The older of the 2 was DOA, and the younger was screaming, "I can't believe I'm going to die," over and over. I can still hear his voice in my head 35 years later. Even worse is their parents' sobs when they showed a little later. It turned out they were brothers. Fucking awful. I was in the hospital for an infection in the bones of my foot. I take medication for a heart condition and diabetes. Nurse came in one evening to give me my medication. She brings me strange-looking pills. I ask her what they are. She tells me 2 medications I've never heard of. I tell her she might have mixed up my medication with someone else's. She says no, she's sure. Take the pills. I refuse. I ask for the head nurse for the floor or a doctor. Head nurse comes in. I ask her what medication I'm supposed to be receiving. She checks my chart, confirms what I'm supposed to be taking. I ask her to ask the original nurse what medication she has in her hand. The nurses leave the room, and a 3rd nurse comes back in with the right pills. Head nurse comes back in and tells me that the original nurse will no longer be responsible for my care. The next day, the nurse coordinator comes in with a digital audio recorder and notepad to go over all the details of what happened the night before. From what I learned later, this wasn't the first incident with this nurse giving out the wrong medications. She had done it to a couple of other patients, and I heard she had been suspended pending an investigation. Don't know what happened because nobody ever contacted me after that. I was a patient. There was an elderly man in the bed next to me waiting to be transferred to a nursing home. The nursing staff treated him as though he was a difficult patient, when, in reality, he was just too frail to do things for himself. Anyway, one day, The nurse refused to help him go to the bathroom as she said he was just being lazy. I could not help as I was bedridden myself at the time. He took a fall and hit his head on the floor. The male nurse just threw him back onto the bed. His family arrived, and I heard them asking the female nurse who refused to help him why their father was so groggy. The nurse lied, saying nothing had happened, and he was fine. I called the man's daughter over to my bed and told her the whole story. Needless to say, the shit hit the fan. I was brought to the ER by ambulance. While I was waiting for a room, another patient was extremely drunk and waiting for a bed nearby. He asked the EMT if he could vape in the hospital, and they told him he couldn't. He proceeded to pull out a vape and try anyways. The hospital staff took it away from him. After about 5 minutes, and when he seemed sure that nobody was looking, he pulled out another vape and tried to take a hit. It was quickly confiscated by hospital staff. A nurse. We had one guy with a history of severe untreated hernias who was admitted because one had grown so large it looked like he had a basketball under his skin, and he needed surgery. Well, before we had the chance to get him to the OR, he sneezed and the stretched skin of his belly just split open like a water balloon and his intestines tumbled out. It looked like he'd dropped a plate of spaghetti in his lap. We draped some wet gauze over the area and rushed him downstairs pretty sharpish.